Namaskar. I'm Dr. Vinod Vijan, Senior Interventional Cardiologist from Vijan Hospital and Research Center, Nasik. And today I'm here on invitation of Lipid Association of India at a national conference. Rather, I should say I'm one of the hosts, and it's a privilege to be the organizing chairman of this very important conference, which will certainly be a game changer in reducing the heart attack death rate and mortality and morbidity in all cardiovascular diseases or ASCVD or atherosclerotic cardiovascular diseases. So let me dwell something in details about this. Lipid Association of India is a society which has been formed, and over the period of years, it really had a struggle to make its voice heard, because so far, whatever we used to talk, eventually we have been talking about various conferences. We are all learned doctors, we are experts in putting all complicated cases, doing angioplasties, bringing out patient from cardiac arrest, heart failure, devices. And yet, in spite of all this, we find that the incidence of coronary artery disease in Indians is increasing shockingly. Whereas in West, they have had a plateau and it is even coming down to the rate of 4% per year. But here, you must all be knowing that even while playing dandiya, young boys and girls are collapsing and dying. People are dying in marathons, in gyms. We have seen important players, dying in the fields, and those even artists performing on the stage and then collapsing and dying. So where are we headed for? And reason is because so far we were just following the guidelines, quoting the American Heart Association, the American College of Cardiology, the European guidelines, and thinking that what is good for them is good for us, the British hypertension and the lipid societies. And here we wanted to have a different sort of a thinking that probably that is not good for us. And we must have our own guidelines which are specific for the Indian population or even South Asia, because we have a shared ancestry. So that is why today, even in the conference, national conference at Pune, we have got international delegates, not only from United States, Britain, but also from Sri Lanka and Bangladesh, from Nepal and neighboring countries, because we share a common ancestry. And believe me, today the biggest cause, the commonest cause of death all over the world is heart diseases. It is not AIDS, not cancer, not even warfare and any other form of a malignancy, but it is yet heart attacks. And we Indians as a race are most susceptible because of our peculiar genetic predisposition. So it is very important for this message to be taken seriously by the public for their own benefit, for their family, because we are seeing young people getting affected. In fact, my talk just recently was treatment of young and asymptomatic, the most difficult subset, who will say कि भाई अरे मैं तो बिल्कुल जवान हूँ, मुझे कुछ हुआ नहीं है, so why should I take treatment? And this is what that myth has to be dispelled here. It started last year when we were invited to New Orleans and talked on a similar topic along with Dr. Raman Puri, who is the soul and founding father of lipidology, and so much so that he has been given a title of the father of lipidology by the US doctors, and which we otherwise see is very polite even not to accept it, but since the doctors there have given them the title, we all follow it, and it deserves it truly. So this Society of Lipid Association was so much welcomed. After our talk, we impressed them in New Orleans, and again we were called last September in parallel with the American College of American Heart Association and in Philadelphia, and there they have sought an affiliation with Lipid Association of India. So see the change, where we used to thrive to go to US to attend those conferences, and now the AACIO, which is the Association of American cardiologists of Indian origin, who are a very powerful group there of more than 3 to 4,000 members. And you know that one of the top posts in the United States, cardiology, are held by Indians. And they felt the need that we should be in touch with Lipid Association of India, and together we should work to bring down the mortality and morbidity of heart attacks. So what are we going to do? The first and most important, which we came across, and today we have even released the guidelines of year 2023-24, and we have even had the privilege of the Ministry of Health, the Health Minister of State, Dr. Bharti Pawar, who saw this. I had discussed with her, and she has endorsed our efforts in bringing down the death due to heart attack. And she has even, in a letter which we can even tell Live TV to post that, along with on behalf of the Health Minister and PM Shri Narendra Ji Modi, in the steps in which we are taking to bring down the death rate. So our guidelines say, just briefly so that it can be understood, is to bring down the cholesterol levels as low as normal. Often what happens when a patient comes to us in a very critical state, we go ahead and do an angioplasty, we open up the vessels, we put them on a different dosage of drugs called statins, and even newer drugs like ezetimibe, bempedoic acid. And this combination, which is a unique study where we are giving these drugs as a subsidized cost, and even doing 6 very complex tests free of cost for the patient. This is known as a OLAT study, and also now renamed as Lipid React study, and where we want to prove that this very cheap combination of drug is as effective as giving biologicals like Ripata, or these are very costly, where one injection is more than 60,000 rupees to be given every 2 weeks. And this is something which would be in few hundreds, which would be equally effective. And these are all new things which we have started by bringing down the levels as per the Lipid Association of India guidelines, which we want every doctor to know. And even many of the important laboratories like Dr. Lal's pathology, they have started writing down the LAI values, because often patients get confused that doctor, मेरा लिपिड तो जो नॉर्मल वैल्यूज में लिखा है उतना ही है, तो फिर आप और क्यों कम करना चाहते हैं? So one thing you must understand, that once a patient is confirmed to have a cardiac problem, treatment with statins and other drugs which may be added to bring down the level of LDL, which is our primary concern. And of course there are more details which I need not talk in this complex channel unless we have further interaction, is to bring it down and continue for a period of time and start early. If we start late, there have been even studies which have been proven that once you say that, okay, now we have found out that you are having raised cholesterol and you are having obesity, blood pressure, diabetes, you have not taken medicines for last 5 years or 6 years or so on, and now you start the same drugs, they don't act that well. So the treatment becomes less successful, more costly, and at the cost of a patient's lifespan and even quality of life. So this message should go very clear to the masses, and that is what I would like to say. If there are any further questions, we would always be there. If you like, please share and subscribe to Live TV or Lipid Association of India TV. Jai Hind. Namaskar.